Good morning. I call this meeting of the Health and Human Services Committee to order. We have quite a list today, and so we're going to do our best to get through it. Senator Abler.
Just before we get going, just a short thing. You know, the news is all about these changes in some of the COVID funding and Department of Health and all that. And I'm sure we're going to hear about it sometime, but just to prepare them when they come, I'd be interested in knowing how many positions that the Department of Health are funded with one-time money. And that, not to be mean, I just want to know so we can understand how rickety our department is or how solid, and at the right time. That's all I have, Madam Chair. Thank you.
Senator Wiklund, any comment to that before we begin our orders of business?
Madam Chair, Senator Abler, do you mean just specifically for that federal money, or are you talking about in general? But I mean,
Senator Abler.
Well, I mean, our whole budget is funded with one-time money, which is why we have a deficit, which we talked about with Healthcare Access Fund and all that. But I'm just curious. Well, I'd like to know the stability of their staffing with the money they have, I guess. And a lot of people, I wasn't intending to talk about it long today, but it's been discussed for a year or maybe longer that COVID money might be clawed back. And so now suddenly it is, which is a surprise, which I wouldn't have done it quite that way. But so they're going to probably come and talk to us. And when they do, if they could just be prepared to kind of give us the comprehensive picture, overview level. Thank you.
Senator Wiklund. All right, we are going to begin today with Senate File 2669. And just because of availability of testifiers and experts and agency staff, we are going to have some discussion initially, then we'll lay it on the table and pick it back up for other pieces of it later in our agenda. Senator Wiklund, would you like to start with the A3 amendment?
actually, we believe that the A3 amendment is DHS items, and so I thought we would leave that until we have the DHS person available so that we can take it up and talk about it and not get sidetracked on that right now. So,
very good. All right, then to your bill.
Thank you, Madam Chair. This is the budget bill for both the Department of Health and the Department of Human Services, and I believe Wendy Underwood is going to present information on the Minnesota Department of Health revised budget changes.
Very good. Ms. Underwood, when you are ready, please introduce yourself and proceed.
Thank you so much, Madam Chair, Chair Wiklund, and members. For the record, I am Wendy Underwood, Deputy Commissioner for the Minnesota Department of Health. Thank you for inviting me back today to share updates in the governor's revised budget. I have with me today my colleague, Brendan Wright, and others who can help answer questions. The revised budget reflects hard work at MDH to identify areas where we could reduce spending while continuing our mission to protect, maintain, and improve the health of all Minnesotans. And so what I'd like to do is just quickly speak to the changes in the revised budget and then address a couple of comments on the recent federal actions. I'm good. Okay, so just going through the changes. And the first item, the current annual allocation of $6 million for the Public Health Infrastructure Pilot Projects Grant Program funds between 10 to 15 innovation projects for a 2-year period. The remaining funding will be $4 million. This will result in a reduction in the number and/or size of grants available to community health boards and tribal governments. We're currently funding 13 projects across the state. The second item, the Emergency Preparedness and Response Sustainability Grants have provided $8.4 million annually to local public health and tribal public health offices to support their emergency preparedness planning, response, and recovery. This proposal would reduce that amount by about 5%. These grants are achieving the intended purpose of supporting preparedness, response, and recovery at local levels to meet the public health needs of Minnesotans during natural disasters, infectious disease outbreaks, and other types of disasters. Examples of this work include ensuring plans are in place, having a response-ready workforce, and trainings. The next item, This program provides funds to eligible organizations to establish scholarship programs for employees of assisted living facilities, adult daycare facilities, and other home care service provider organizations, or HCBSs. The program also repays qualified education loans for employees nominated by their HCBS provider. Scholarships and loan forgiveness cover costs related to education in nursing and other healthcare fields for employees working in direct care HCBS roles. The program currently awards $1.45 million annually, with about 2/3 of the funding in grants and the other third in direct loan forgiveness. This appropriation reduction is $250,000 a year beginning in FY26. And the reduction in grant funds would result in fewer organizations receiving grants for employee scholarships and fewer direct care workers receiving loan forgiveness awards. The next 3 items are related to cannabis. The first item, Cannabis Youth Grants, provides funding for community-led initiatives aimed at cannabis and substance misuse prevention for youth. This program provides a framework for local coalitions to develop community-specific prevention plans based on their unique needs. It offers communities a step-by-step guide and other support to help with their success. The primary focus for this prevention is cannabis, but also alcohol and commercial tobacco use. Current base funding is $1.5 million a year. The second item related to cannabis, in 2023, $795,000 was added to the Poison Control Center Fund specifically to address an increase in services tied to the legalization of cannabis. Calls to poison control centers traditionally increase with legalization of cannabis, most often due to children ingesting cannabis unintentionally. This funding is needed to support the Poison Control Center's ability to provide service to the public and health professionals 24 hours a day at no cost to users. It's just like a 911 style statewide service. And the last item, cannabis prenatal funding. This program, largely focused on education, was created in response also to the legalization of cannabis products to ensure the safety and well-being of pregnant people and their infants, children and families. The program is focused on educating the community on the adverse health effects of prenatal exposure to cannabis products and on the adverse health effects of exposure through secondhand smoke, breast milk, or ingesting cannabis products. It was felt that a reduction beginning in FY28 could be sustained due to the necessary upfront costs for establishing the statewide education network and the infrastructure that goes into that. By FY28, the market will be saturated with the materials, and the remaining ongoing funding would go to just keep that up to date. Those are the items within the revised budget. But I do want to take a moment to address a very real-time financial crisis we are all facing with our federal funding. I appreciate Senator Abler mentioning it at the start. On Tuesday of this week, just about 48 hours ago, we received notice of immediate cancellation of grants from the Center for Disease Control and Prevention, or the CDC. We were told all use of funds must cease immediately with 30 days to submit all final invoices for reimbursement of expenses. These grants currently total $226 million and fund a wide range of local public health, tribal public health, and community-based programs across Minnesota, as well as nearly 200 employees at MDH. This is roughly 25% of our current fiscal year funding. We are actively working on several fronts to address our nearly 200 grants and contracts with Minnesota's counties, tribes, nonprofits, and others, as well as the impacts to our employees and the costs to our state this immediate action will bring. I want to add, and this is also in response to a question I appreciated receiving from Senator Utke earlier, and is really, really important to know. And to Senator Abler's point earlier, these funds were not intended to be in perpetuity. These were federal grants. We have been preparing for months in anticipation of these grants ending over time. The first of these grants was set to expire this June, another more expiring in December, and well into 2026. The federal government had and has been approving the use of these funds through these end dates. We have extensive work plans and agreements with the CDC. The immediacy of the funds cancellation is what is causing harm. We can't continue programs that, while established during the pandemic, have brought great support and access to public health services across the state. But we can't responsibly support our partners and our staff in transitioning and phasing out work and making responsible changes as we have been working on over time. We can't do this because there is no time and the funding is too great. I want to just rest with that for a second. And we definitely plan to keep the chair and this committee apprised of these impacts as more information comes together. It is complicated. It involves so many entities, so many people sitting right behind me, and it is very real time. So information is changing hourly and daily. Madam Chair and Chair Wiklund, those are my comments, and I'm happy to answer questions.
Senator Wiklund, any further comments before we move to discussion? Okay. Members, Senator Port.
Thank you, Ms. Underwood. Can you talk a little bit about what that money is used for, what those sort of public health programs are that have been built with this money?
Sure, absolutely.
Ms. Underwood.
Oh, thank you, Madam Chair. Absolutely. The funding, the grants did originally start in response to the pandemic in recognition of what we've all known, especially members who have been in this work a long time, but to help really support the gaps in public health response that we've had across the state. And these gaps range in having immediately accessible and free vaccine clinics. It means access to critical data and the infrastructure to collect and share and disseminate and use that data so that smart decisions can be made, so that concerns can be identified early and prevented. In communities, it was meeting needs that local and state funding weren't meeting. As you know, the Minnesota Department of Health is 50% federally funded, but that's not just across the board. We have areas, particularly infectious disease, our public health lab, are between 90 to 100% federally funded. And so these funds have been used to help fill in those gaps, and which it has been doing very, very successfully, and has established really key infrastructure that our partners are relying on. And knowing that the grants have deadlines, the work has been put in place to decide what are we going to do. So if I'm a county right now, I've known that my funding was going to end in July of 2026 for my community clinic, let's say, or my community vaccination center. And so as a responsible human services director, I have been planning my next year's budget, and starting this summer would be working with my board on where could we find the funding to be able to continue this critical service. By this funding ending immediately, as of Monday, as a county human service director, I don't get to do that.
Madam Chair.
Senator Port.
Thank you. Thank you. Ms. Underwood. I think, this infuriates me. I think we learned in the pandemic that a health crisis can come on so quickly, and that we did not have the infrastructure in place in order to respond to that. Because of that, many people died, and many people got sick, potentially forever, including myself. And these public health programs that are out there, that are doing research, that are talking to people, that are reaching into communities that don't have access to healthcare on a regular basis, they are what is helping us learn how to not do that again. And as we have other infectious diseases that are popping up, that are spreading to different kinds of livestock and animals, and we don't know what's going to happen with it, the fact that we are taking away this infrastructure right now is not only irresponsible, it is cruel. And I can't understand why we would look at this moment and say, our choice, the country's choice, because budgets are choices, they are policy choices, is to take away this money that is helping to ensure that people have access to healthcare, that they can get vaccines that help the spread of infectious diseases. We're going to take that away just because we don't like it. And we're going to use that money probably for tax cuts, but we're going to take it away because we don't like it, because it says the word COVID. And you said up to 200 employees who learned yesterday with us all that they're done. Their jobs are done. There is no way for us to fill this hole overnight. That is an incredible human cost that is both to the employees and to the work that they're doing, which means the entire state of Minnesota. I am infuriated on behalf of you all. I will continue to work with you to figure out if there are any ways that we can, work on this. But this is devastating for the state of Minnesota, and I think we should be very clear and upfront about that. I'm sorry you have to come and talk to us about this today, but it's important that the state understands what the impact of this is.
Thank you so much. Madam Chair.
Ms. Underwood.
Thank you so much. And I do want to clarify, because I've had a lot of team members' hearts are racing right in this moment. We have not yet submitted notice of layoff to the FTEs because of the rapid work to appreciate and to Senator Abler's point earlier, to appreciate what employees are fully funded versus which are a blend of different things to be able to achieve the work, and what can be shifted and addressed to be able to retain as much talent as possible and to bring as little harm as possible. Because also, by not being able to phase out the roles and the work, or to be able to transition, and instead having to lay off, and I mentioned in my remarks the direct cost to the state, a layoff is not the same as moving into a different position or phasing out, et cetera. I mean, a layoff comes with significant costs. It comes with the payout of sick and vacation time. We provide 6 months unemployment and 6 months contribution to insurance. So we are rapidly working to figure out that. And we don't have, you know better than me, we don't have a fund sitting to fill those costs, which is also a direct result of this immediate action.
Thank you. Senator Abler.
Well, thanks. I didn't know I was going to get that big of an answer, and I'm so sorry. I have a couple questions and I have a comment. So how much this money flows to the counties?
Ms. Underwood.
Just a
Thank you,
ballpark. You can't know everything, but half of it or something?
Yeah, thank you, Madam Chair and Senator Abler. I was just asking that question early this morning. We do know, just by looking at what hasn't been spent through our grants and contracts, that there's a good $50 million, but the total of the COVID grants that were distributed to our partners, I have asked for, and we'll get back to you. I'd like to know that too.
Well, and
Senator Abler.
sorry for the technical questions in the middle of all the other hard stuff. But so if the counties have gotten the money, they get to keep it. So they're not going to lose their
No.
money, or they don't have to mail that back.
Madam Chair.
Ms. Underwood.
That's incorrect, unfortunately. Anything that they have an opportunity to submit for their reimbursement, any expenses from March 24th back, so Monday, when we were notified Tuesday.
Oh.
So any expenses incurred up to March 24th, there's 30 days to submit for receipt, which is also an extremely daunting task. But for any county who has an employee funded in part or whole by these dollars are today figuring out how to keep paying for them or laying them off, just like we are at the state.
So they're in,
Senator Abler.
they're in the same world of hurt as you.
Yeah.
Well, I don't know, this is not the way to do business. And it's just not right. You know, and to the grand scheme of things, I sat with your commissioner and I said, you know, I warned in 2011 that $8 trillion was a lot and we should be careful, and now here we're at 36 and that's a lot. But that doesn't, this is not the way to do it. And so I wrote a letter about the Medicaid. Help me write a letter to this, and I'll co-sign it with your commissioner or whoever else wants to write it. But this is not the way to do business. You have a contract, you keep your contract. Or you have a process where you break it over time to soft land the program. I just, you know, it's not right. So maybe you can give me some advice, Ms. Underwood, about how to get that out today. Thank you.
Ms. Underwood, any response?
Madam Chair, I appreciate it very much. I'm happy to support you.
Other questions or comments, members? Senator Mann.
Thank you, Madam Chair. Ms. Underwood, what does this mean for our public health infrastructure?
Yeah.
Ms. Underwood.
Madam Chair, Senator Mann, thank you so much for the question. We are really wrestling with that too. Because of that immediacy. We were already very intentionally struggling with what is it going to mean over the next 18 to 24 months. And so, I mean, its impact today means that work has stopped. I mean, notices to grantees and contracts were sent on Monday evening to cease activity and to submit payment. So I don't know for sure, but there's very likely a community vaccine clinic in a community that couldn't open yesterday because they lost their rent. They lost the access to what paid the rent. I wish I could say for sure that happened, but I'm guessing it did. Because our counties, our partners, can't spend money that they don't have. None of us can. And so people had to make very fast, very, very painful decisions until more could be sorted out or solved if possible.
Senator Mann.
Thank you, Madam Chair. So, I mean, the federal government came for NIH grants, which paused medical research, and we had to get rid of researchers. And then they came for the CDC. They shut down the weekly mortality report website for the first time in 70 years, which is how we share information across this country. They fired 2/3 of the president's malaria, what is it called? The Worldwide Malaria Project, which started under George W. Bush, which keeps malaria off of our shores. So, you know, then they went for USAID, which stopped critical research and humanitarian aid across the globe. We can't withdraw support from infectious diseases across the globe and not expect that to come to our shores. And now we're seeing them cut funding right in our backyards. What we are seeing is the systematic destruction of our public health infrastructure. And without that, people are going to die. And I don't know in what other words to say. We've been seeing it for months, but now it's here. It's right here. I don't know what else we are going to need for us to stand up as a people, to rise up and say we're not going to tolerate this anymore. We're not going to tolerate the systematic destruction of our society anymore. I'm just wondering how long it's going to take for us to do that, because now it's here in our state. Thank you, Madam Chair.
Senator Abler.
Well, thank you. And changing gears just to the changes in the budget.
Sure.
Just kindly spoken, I would have done none of those. At least they're going to be wound down, and you're announcing you're not doing them. This is a proper way to do it. The governor, or the governor is in this case, makes choices. The cannabis grants in particular, I'm worried about cannabis anyway, as a former cannabis guy, which did not improve my life. I have friends who are dead. I am worried about that. So I'm, given the context, I'm just, and the scholarship grants and how do we draw more people into 50,000 people. And I just, there are difficult decisions made everywhere. And I don't think that you sat around in your meetings and said, hey, let's get rid of these programs. And so just on a smaller scale with, I don't know the intent of what they're doing out there. I'm gonna write a letter and say, what are you thinking? And I think on else on the floor, I'm gonna write a letter and then people can sign on if they want and whatever, hopefully they'll notice. But these are very challenging times. And it's, at the very least, it's a call to like think about what are the priorities that we have as a state. What's essential, what's important, what's nice. We did it in 2011 and got through that time. And in a thoughtful, collaborative way, you know, Senator Mann, Senator Port, to like what's important to us and not haphazard. So anyway, thank you for that.
Madam Chair, if I may.
Ms. Underwood.
Thank you, Senator Abler. For what it's worth, as I was preparing for this hearing over the weekend, I wasn't looking forward to sharing these reductions. And yes, and things have progressed rapidly. Yeah.
Senator Utke.
Thank you, Madam Chair. And I don't know where we're going to have more testimony on this bill at this point before we go into the questions for the heart of the bill, or where do we want to take those?
Madam Chair,
Senator Wiklund.
Senator Utke, we won't have verbal testimony on this bill today. You have a number of letters in your packet, and written testimony was solicited, and you have a number of letters in the packet that are related to the MDH portions of the bill and to the DHS portions of the bill.
Senator Utke.
Thank you, Madam Chair. And maybe I worded that a little bit wrong because you've got the department sitting right next to you. I didn't know if they had more that they were going to give to us before we got into this, but I see the heads saying no, so then I will I'll ask
Senator Utke, we do have Elise Bailey here who will speak to the other section of the bill, the DHS section.
Okay, but my questions are related around Department of Health, so
Proceed.
We'll start off with that, and that's at the very beginning, and we get into all of the fees, which is just staggering what we're going to do with fees. And you must have some sort of an idea, and my first question is, what is your anticipated increase in revenue from all these fees? Because you have to have a plan of how much is going to flow through. What is that number?
Ms. Underwood.
Madam Chair, Senator Utke, thank you for the question. I am going to turn it over to my colleague, Mr. Wright. I will start by saying these items are our direct sources of revenue for these for this direct work in these different areas. But I appreciate the question. I'll ask Mr. Wright to answer that.
Mr. Wright, please introduce yourself and continue.
Thank you, Madam Chair. Brendan Wright, Legislative Budget Director for the Department of Health. Senator, to your exact question, I can get back to you with those exact numbers of the overall increase with that. But like the Deputy Commissioner said, those are specific to those areas where we do need those increases in both revenue and then from the SGSR expenditure.
Senator Udke.
Thank you, Madam Chair. And I know fees typically flow through, but yet they are a tax increase because in the end, Minnesotans pay these things. And so that's why, if you could get that to me, I would appreciate it. Have a couple more questions related to some that's in the very front of the bill, and that's to do with our wells. And, you know, I see information where basically the program has been upside down. There's been a shortfall since 2017. It's 2025. And now we're taking some huge, huge increases. Has this been proposed over the years to do it in smaller increments? Or why are we taking such a huge jump today?
Mr. Wright.
Thank you, Madam Chair. Yeah, these are increases that we've been identifying that need to happen, and some of these haven't been increased for a number of years. And so we're looking to find a good opportunity or a good time to have these increases and be able to fund and maintain the staff to do the work.
Senator Udke.
Thank you, Madam Chair. And along that kind of goes with the planning and gearing up, because one of the things that's been highlighted is the geothermal technology. Because of the new demands or, you know, the increasing demands, et cetera. But this has been part of the governor's initiatives for the clean energy of 2040. So it's nothing that just got dropped on us January 1 of this year. This has been something in the works for quite a while. So is it just lack of staff, lack of planning? There's got to be something there where the ball, I mean, it just didn't rise to a priority till now.
Mr. Wright.
Madam Chair, Senator Lucky, I think it can oftentimes be a combination of all that with rising costs. We find that we would need more SGSR to maintain these programs. So I think with all of that and new directives coming in, we find that program would have to ask for these increases. So I think to your point, it can be a number of things that can cause this. Many times though, as you see, when we're not increasing a fee for almost a decade and then we see the rising costs of everything else go up, we then find that eventually we're going to have to raise that fee. And that can be, you know, going towards anything like IT infrastructure and all of that surrounds how this work is done. So it is a number of things that contribute to this.
Senator Udke.
Thank you, Madam Chair. And yes, I think actually this is on a Department of Health memo where it says, looks like it's about an average of 40%. So it is a sizable step at this one time. So I think that's what's getting everybody's attention, is the fact that it is such a giant step versus inflation increments, et cetera. But a question related to the environmental well maintenance and the fees, et cetera. Government agencies aren't paying, whether it's the feds, the states, the local governments, even rural waters, but yet it all falls on private. Why is that? You're doing the same work, whether they're government agency or private, but we don't charge the government.
Mr. Wright.
Thank you, Madam Chair. For that specific question, I would probably have to defer to expert that we might have on staff, or we could get back to you with a better answer. I'm not exactly sure to the specifics of why private as opposed to another source.
Looks like we have someone coming forward who could answer.
Somebody coming to join you.
Please introduce yourself and continue.
Good morning, Madam Chair and members of the committee. My name is Tom Hogan. I'm the Environmental Health Division Director, of which the well program is a part of that division. I think the history of that fee, it was initially instituted, I want to say, in the early 2010s to include government agencies. And I believe through legislative action in 2017, those payers of that fee, government agencies, were removed. not exactly sure in my history bank why that occurred, but that's kind of where we're sitting right now.
Senator Edke?
Thank you, Madam Chair. And thank you for that. I guess it's always been something, I go way back to, why do government agencies pay taxes? Because they're paying with tax dollars. Here, they would be using tax dollars to pay fees. I can understand that, but yet, in the end, it all gets dumped on the private sector back into the areas where, these well inspections, et cetera, are going for fees. So I think that probably the only fair thing at this point is it'd be nice to see them go back across all payers, whether it's the feds, the states, et cetera. Particularly the federal government, we can let some of the taxpayers in the other 49 states help pay our fees. But it's just something that's come up and it was highlighted. It's once again, we cut out the government, and so that was a concern. I think that's all I have related to the wells at this time. And just overall, we've talked wells. You can go into the nursing homes and the hospitals, et cetera, assisted livings. These big, huge fee increases are concerning across the board at a time when we're cutting their funding. We're cutting them back. It just kind of complicates and piles on. So the concern will go forward as we progress through this bill. So thank you, Madam Chair.
Senator Liskey?
Thank you, Madam Chair. Madam Chair, Senator Wiklund, I'm reading through the fees. I have the same issues as Senator Edke does with the fees. I find it interesting that we're going to raise fees on all of these healthcare providers, all of these other providers, and unfortunately, we didn't get the raise in their reimbursement rates. And so not only are we now going to raise their fees to have licensure and things of that nature and expect them to pay more, the government's getting its pound of flesh for the increase of inflation, but we're not returning the favor to the providers that are in the networks that are honestly providing the care. It's the same speech I gave you at the beginning when we heard this the first time, just the idea of what was coming, and now we have the bill in front of us, and it looks like nothing's really changed. Something that I asked back then was, we're here to try and reduce the cost of health care. This bill does the exact opposite. And I don't understand why this is what we're going forward with. So, thank you, and I appreciate that.
Senator Wiklund?
Can I make, Madam Chair, Senator Liskey, just a comment. I think that, yes, we want to not raise fees indiscriminately and not affect people in that way, but I think people are affected if we don't raise the fees and we aren't able to provide the services that they need in a timely manner. When I read through the change pages for the different fees, some of these are causing really excessive delays for some of the people who need the services provided by the agency. And so I think, yes, it's challenging, and I don't know why maybe there haven't been increases over time, except that every time an increase is proposed, it is usually countered with we can't raise fees or we can't add taxes. And so it is challenging for the agencies to bring new fees or additional fees forward. So I think that the information provided tells us more about, in the change pages, tells us more about why the fees have been proposed to increase. And I think we need to take into consideration that the lack of increases will affect people in a way that can cost them, time and money, not being able to get projects done or work done that they need to. As far as increasing the rates for providers, I think that it's clear that we have many people who have the will to increase the rates, and clearly do not have a budget that can sustain an increase in the rates at this time without taking some other form of action to provide that. So that, just wanted to make sure that that's out there as well.
All right, we are going to move from this section to the DHS section. I'll just close by saying thank you to the department. And not to take us backwards, but to see the chaos and the cruelty that is coming from the federal government and the human impacts that is going to have in terms of the work that the Department of Health does is really sort of hard to wrap your head around, the human impacts that will have, both in terms of potential job loss and what that means for people, but the work of this department. This will mean that people will have less access to vaccines, will have less access to care. This will make all of us less safe, and it is wrong. So, Madam Chair, any closing comments on this, or as we move to the DHS portion?
Just to restate, I guess, some of the things that you mentioned, this is really devastating to have occurring right now. I think it's very sobering as we are moving into a phase of discussing how to put together a budget, that now we have these other huge impacts to the agency, and we just know that we won't be able to fulfill those impacts through changing our budget approach. I just wanted to also comment. I mean, we talked, or many have mentioned, like the county impact. I mean, the employees and that, but also this is affecting tribal nations as well. They've already been affected by impacts to Indian Health Service, and to add another impact on them to reduce services is really devastating. So I'm very sobered by this all. So thank you.
Thank you. We will move to the DHS portion, and I will invite Elise Bailey to come forward. Please introduce yourself and proceed.
Madam Chair,
Senator Wiklund.
Can we move the A3 amendment now so that we can have that before us?
Yes, Senator Wiklund moves the A3 amendment. All those in favor say aye.
Aye.
Aye. All those opposed? Motion passes. The amendment is adopted. Ms. Bailey.
Thank you, Chair and members of the committee. Elise Bailey, Budget Director for the Department of Human Services. And I think I'm just going to quickly go over the changes in this bill compared to what you had heard in our presentation a few weeks back. So what is in the revised budget and what was in the amendment. In the amendment, we have, of course, changes to all of our proposals related to updating the costs according to the February forecast. That's what we traditionally do with the revised budget. And then there's three key changes in the budget related to kind of larger swings in costs that I'll mention. One is the proposal around the pharmacy carve-out. So again, this proposal is essentially taking our pharmacy benefit out of our managed care contracts and administering it through a sole administrator. The original proposal had an effective date of 1/1/26, but while we were repricing in between doing the original budget and the repricing, we determined that that timeline is just too quick to effectuate the change. So we had to shift out that effective date to July 1st, 2026. That means that there's some kind of wonky swings in the financing of the pricing of it. One is with the withhold buyback. So it really has to do with the timing of payments to managed care organizations. And right now, we withhold payments and then pay them in the future fiscal year. And when we pull services out of managed care and put it into a fee-for-service model, we have to account for those payment shifts over time. That means that the shifting out of the effective date means that in the change page, you'll see lower savings because we have to buy back that payment shift. off spreadsheet, though, there will be more savings. So it's just a matter of when things occur and the timing. And then, of course, with shifting out the effective date, the savings that we would attribute to increased rebates and lower administrative costs are lower because the effective date is later. We're also updating the administrative costs for administering the benefit, and that's not for DHS, but it's for a sole administrator that we would contract with. And then lastly, we clarified that this proposal is not impacting Minnesota Care. It only impacts the MA program. The total savings of that proposal now is $3.7 million in 26-27 and $15 million in fiscal year 28-29. The second big change is in our original proposal, we had increased the surcharge on health maintenance organizations. Typically in the past, when we have a surcharge, that same amount also gets incorporated into the capitation payments for our managed care plans. That is to ensure that our rates are actuarially sound. But in our original proposal, we had an error and that wasn't included. And so in the revised budget, you'll see that there is a corresponding increase in managed care payments to correspond with that surcharge increase. The net result is less savings, of course, because we're spending some of the savings on increased payments to managed care organizations. The updated impact is $136 million in 26-27 of savings and $128.5 million in 28-29. The last larger change in our revised budget is we included a new component to our housing stabilization services proposal. The original proposal was just adding 3 FTEs at the department to, speed up the processing of applications for this service. And we're adding a budget neutral change now that clarifies what the financial eligibility is for housing stabilization. So we realized in between doing the 2 budget cycles that the federal guidelines for receiving 1915I state plan amendment services require that people are at or below 150% of federal poverty level. However, our Minnesota statute currently says that a person must be enrolled in MA to be eligible. So there's a small population of pregnant individuals who can qualify for MA if they are at or below 278% of FPL, creating kind of this small discrepancy for this specific service. We are already aligning with federal guidelines as required by the feds. So this is a budget neutral change, just clarifying state law to align with federal law. With that, I will kind of stand for questions.
Questions, members? Senator Abler.
Yeah, I'm sorry I stepped out. Maybe you already clarified this. We're on the A3 amendment, right?
We adopted the A3 amendment. We're on the bill at this point.
Just on the bill, okay, fine. But on the A3, the background studies for the EIDBI people, is this an effort to combat some of the problems? Some of the operators, you don't know who they are. Is that the point of that? It's on line 2.9 of the A3.
Senator Wiklund.
I'm sorry, which line?
Oh, I don't know.
Senator Abler.
No, I just want to look at the.
Oh, yeah,
amendment.
line
2.9.
2.9 on the A3. There's a couple of places where, and then 3.17, where you're doing some EIDBI. I'm very interested in that topic, and I'm trying to find a way to get that project done this year yet, if we can, to crack down on some of the bad, on some of the procedures that are pointless. But is that going to address some of the concerns that have come out of some of the abuse?
Ms. Bailey.
Chair Wiklund, Senator Abler, yes. I might have to phone a friend on that specific line,
Well, that's
but
fine. We can take it offline.
yeah, my understanding is, anything in the amendment is kind of clean up from our original proposal, so we didn't change anything related to like the intent of the proposal.
Yeah,
But
okay. Well, and so
Senator Abler.
thank you. We haven't spent enough time talking about background studies, which are still, I'll say, not going as well as you might like. Yeah, I didn't use any other words to describe that, but it's, they're more expensive than they should be. They've just taken on a life of their own, and it's really hamstringing operations, so I'll just be sure we don't cause harm about that. And just to the whole bill, with what just happened, actually, I'm going to ask you at the end what impact you might have had on this sudden change, but the efforts that we've made, even in this year's budget, which is probably going to leave this committee where we attempt to arbitrage a lot of just massive money from the government, from the feds for free. You know, I've been pointing that out for a long time, and so we're about at the end of that pipeline, and maybe there's one more grab at it which will work, but that day is over, whatever the president might be, because we're paying $1 trillion a year in interest. $1 trillion. The budget used to be $2.5 trillion for the whole federal budget. And people cautioned about borrowing too much, and here we are at $36 trillion. So anyway, that's my comment. But did you comment about
Yes.
the reductions from that? Did I miss that, or did you comment about
No.
that? yet?
Ms. Bailey?
You mind?
Chair, Senator Abler, yes. So since Tuesday, we had about 6 grants impacted by the cancellation. 2 of them had already been scheduled to cancel this month, and so we don't find a fiscal impact from that. But the 4 that were that were supposed to expire September 30th, 2025, total up to about $24 million. There are 4 grants. We think that we'll have at least 100 contracts within those grants, many of which have been encumbered. So we already, the grantees are already planning to do the work and have been doing the work, and the money had been cut, of course, abruptly. They are of broad scope, and many of the grants also are kind of, the grantee is also getting other funds in some instances. So right now, the work that we're doing is kind of looking into, you know, are there different funding streams that grantee is receiving, and what is the exact impact to people across the state? At this point, we are concerned, of course, with a $24 million immediate elimination of funding. And these are grants, let me kind of, the mental health block grant, COVID mitigation grant, the mental health block grant, ARPA grant, another COVID mitigation grant, and another substance use ARPA grant. So they're mental health and substance use programs.
That's very helpful.
Senator Abler?
I'll yield. I'm done. Thank you.
So maybe I'll just jump in with a question, then go to others. Ms. Bailey, so based on what you just said, can you just clarify what that means for Minnesotans? So it sounds like mental health care, substance use care, that funding is cut off. What does that mean for Minnesotans?
Chair Boldon, that's exactly the work that we're doing. Of course, this happened abruptly, and we're scrambling, and we're looking at seeing as these funds, you know, cross at least 100 different grantees and 100 different contracts, looking into what is exactly the impact. I mean, each individual contract is different, and so we will definitely want to follow up with the committee on the exact impact and the fallout, essentially, from the funding being cut so urgently.
Thank you. Other questions or comments, members? Seeing none, Senator Wiklund.
Well, thank you, Madam Chair. If there are no other questions right now, we wanted to get these bills, or this bill, move forward, but it will be laid over, and then we'll have a chance to have more questions or discussion if they're needed. But thank you, and yeah, we just wanted to make sure that we heard these proposals and heard the updates after the forecast.
Thank you. With that, Senate File 2669 is laid over for possible inclusion in a future omnibus. And we will move to Senate File 2705 in relation to DCYF. Senator Wiklund.
Thank you, Madam Chair. This is the Department of Children, Youth, and Families budget bill, and I believe we have an amendment, and we have Ashley Reisenauer, who's here to speak to the bill. And let's see, the amendment came from the agency. Would you like us to just adopt? If we could adopt the A31 amendment,
Senator Wiklund moves the A31 amendment. All those in favor say aye. Aye. All those opposed? Motion passes and the amendment is adopted. Senator Wiklund.
I'd like to turn it over to the testifier, please.
Welcome to the committee. Please introduce yourself and proceed.
Thank you. I'm Ashley Reisenauer. I'm the Chief Financial Officer for the Department of Children, Youth, and Families. And I think I'll briefly go through the three primary changes that are in the revised budget. The first, which you'll see on a change page entitled Licensing Information Federal Compliance, being it's on page 56 of the DCYF budget book. This is a proposal that has just a one-time cost of $200,000 to update the Department of Human Services Licensing Information Lookup, also known as LIL. LIL is Minnesota's consumer education website with information about DHS license programs. The update to this system will allow us to display additional information on pre-licensure inspections and posting all items that are reviewed at a visit. It responds to an August of 2023 site visit by the Federal Office of Child Care that found that Minnesota wasn't complying with all the CCDF regulations by not posting that information. The second change, which is in the change page titled Technical and Administrative Changes from the Department of Children, Youth, and Families. It's on page 53 of the budget book. Historically, this early childhood literacy program has been administered by MDE and it has been allocated to Reading Corps, which is an organization that works primarily with kindergarten through grade 3 and also supports Head Start programs. This amendment just clarifies that the funding will remain at MDE. The program was most recently funded in the 2023 session with a total of $7.95 million per fiscal year. In 2024, the statute for the program was recodified to the Commissioner of DCYF, and because of it's embedded within the statute that provides authority to administer Head Start. So that was not intended. So this just clarifies that the base appropriation for that early childhood literacy grant program will remain at MDE and continue to be administered by MDE. The third change is just a technical change for the funding mechanism in the Child Care Assistance Program improvements. It's a provision that was included in the original governor's budget recommendations, and the components of the change page haven't changed, just the mix of federal funding. So the previous version included a transfer from the Temporary Assistance for Needy Families to augment the Federal Child Care Development Fund. This version just uses funding from the Child Care Development Fund, or CCDF, in order to fund the changes, and then there's also the same small general fund dollars to support some changes to MEC squared. So the revision really just leverages different federal funds more effectively. So those are our three primary changes, and happy to take questions.
Questions or comments, members?
Never mind, it's not your department.
Seeing none, Senator Wiklund.
Well, thank you, Madam Chair. And I wanted, as with the previous bill, wanted to get this bill heard so that we had the information about the budget bill itself and the revisions. This will be something that we take into consideration as we put together an omnibus bill for this committee, and so I appreciate the time. So thanks.
Thank you. With that, Senate File 2705 is laid over for possible inclusion in a future omnibus. Senator Wiklund, Senate File 2620, to your bill. Would you like to move the A1 amendment?
Yes, Madam Chair, the A1 amendment. I'd like to move.
Senator Mann moves the A1, Senator Wiklund moves the A1 amendment. All those in favor say aye. Aye. All those opposed? Motion carries. The amendment is adopted. Senator Wiklund.
Madam Chair, this bill is the Department of Human Services policy bill. We're starting policy bills now. First two bills were budget bills. These remaining bills will be policy bills, and I do have a testifier here to speak to this Senate File 2620.
Welcome to the committee. Please introduce yourself and proceed.
Thank you, Madam Chair. Ari Didian, Legislative Director for the DHS Office of Inspector General. So 2660 includes several policy provisions. Sorry, hold on, let me get my notes back up here. And so this includes several policy proposals from the DHS Office of Inspector General. This contains a prohibition on kickbacks in the medical assistance and CCAP program. And so currently, kickbacks are illegal under federal Medicaid law. We do not have a prohibition in state law. And then there is no federal prohibition on kickbacks in the CCAP program, but several other states have implemented an anti-kickback law at the state level. And so we based the CCAP portions on that. There is also a number of updates and changes to mental health and substance use disorder licensing policy. These generally are clarifying or reducing requirements. There are also several areas where we've seen really frequent requests for variances, and so we've opted to put those into statute. There are sections, a couple of sections just clarifying a previous change. We moved several license types to a continuous license process rather than having a annual renewal. And so there are some sections that just clarify which license types are currently on the continuous license process and which licenses continue to be issued on the previous schedule. Additionally, there are some clarifying and technical changes related to background studies chapter 245C, just clarification on the arrest and investigative information that we can obtain, codifies that we can use electronic signatures in Net Study 2.0. And then there are also some clarifying changes related to home and community-based services licensing. And then finally, there is a provision related to human services judges. Last year, a law passed protecting personal data of judges, including the administrative law judges at the Office of Administrative Hearings. The human services judges who work at DHS are very similar to the administrative law judges in their capacity, and so we just think that this was overlooked. And so that is the OIG policy bill.
Questions, members? Senator Udke.
Thank you, Madam Chair. And my question falls in Section 17, which deals with the SUD facilities. And with what's here, the way it's written, it would leave out Scheduled 1 drugs, which includes the heroin, LSD, marijuana, et cetera. Why would we do that? I guess you can understand with what's been done around this place with marijuana the last couple of years, maybe, you'd be highlighting that, but the fact is, it's still illegal at the national level. It's a Schedule 1 drug. It should be included, but this is being left out. Can you enlighten us on that?
Ms. Didion.
Thank you, Madam Chair. Senator Udke, I think this is just updating what license holders have to have in their policies and procedures related to these drugs. And so I can check back with my folks on why the specific items were chosen. This was related to the license holders' policies and procedures related to those medications.
Senator Udke.
Thank you, Madam Chair. And yes, I'd appreciate it if you do check back with them, because I would think having this documentation in their possession would be pretty important to their operation, because I'm sure they see plenty of activity coming from these listed drugs, and to me, it'd be quite an omission that would be inappropriate. So I'd appreciate the follow-up.
Senator Mann.
Thank you, Madam Chair. Senator, I was just looking at that piece too, and it's just that the license holder has to implement written policies regarding its medications that they have in their facilities. And Scheduled 1 drugs would not be something that they would have because they're not prescribed medications, they're like street drugs. So they would not have those in the facilities, and that's why they were left out. But I could be wrong.
Other questions or comments, members? Senator Abler.
Well, thanks, and just reading this bill for the first time, I'm curious on 21.22, you're allowing someone to watch somebody's kid for 3 hours a day in the same building. Just, it seems like it's a flexibility thing, but how did you come up with 3, and how many people are going to be working for only 3 hours, and is this really going to help anybody? Maybe you can comment about that, please.
Ms. Didion.
Thank you, Madam Chair. Senator Abler, this is actually an exemption that other license types already have to provide this limited type of childcare without having a full child care center license. And so we modeled it back based on that existing requirement. We've just expanding the types of programs that can utilize this. This is just for if their parents are on site receiving services. I don't know exactly why the 3 hours was chosen, but I think this was based on an exemption that we had for other types of licenses to provide this limited
So it's more of a
childcare.
client
Senator
stopping
Abler.
into a county service center or something like that. Not really for staff. That's helpful. Thank you.
Other questions or comments, members? Seeing none, Senator Wiklund.
No, I don't really have any other comments. I think if members had questions or if something comes up, please let the department know, and I appreciate the time.
Very good. Senate File 2620 is laid over for possible inclusion in a future omnibus. And next, we will go to Senate File 2778, Senator Kupec.
Senator Kupec.
Good morning. Thank you, Madam Chair. This is the DCYF policy bill. The bill contains policy technical housekeeping updates to statutes related to economic assistance, child care, child welfare, and the provisions in this bill have no fiscal impacts. So with that, I am happy to turn it over to the department to run through the bill.
Thank you, Senator Kupec. And you would like to go first? Please state your name for the record and begin your testimony.
Thank you, Madam Chair, members of the committee. For the record, Nick Dem with DCYF. First of all, just wanted to thank Senator Kupec for carrying this bill on behalf of the department, and thank you, Madam Chair, for hearing our bill today. As Senator Kupec noted, SF 2778 is the DCYF policy bill, so we'll provide a quick walkthrough of each article and then would be happy to answer any member questions. So starting at the top here with Article 1, the Economic Assistance Article. This includes one section that provides an exemption to the current 5-year term limit on state contracts for the state's Electronic Benefits Transfer, or EBT contract, allowing an initial 5-year term with extensions up to 10 years total. EBT is one of the state's largest critical automated systems, distributing at least $1 billion in food and economic assistance benefits to more than 225,000 households annually. The USDA places multiple requirements on states regarding their EBT systems, contributing to a complex and lengthy process of procuring EBT services that can last 2 to 3 years. Given the current 5-year limit on state contracts, this means the state is in a near constant process of reprocuring its contract for EBT services with a private technology vendor. Allowing longer contract durations will eliminate the need for DCYF to engage in a near constant procurement cycle for the state's EBT system and improve efficiency in the procurement process. So that is Article 1, Economic Assistance. I'm going to quickly skip ahead to Article 4 and explain that article before I hand things off to my colleagues. So Article 4, and this is on the last page of the bill, this is really just some technical language the revisor's office put in our policy bill this year, ensuring that any session laws that mistakenly grant powers or duties or responsibilities to DHS for programs or services that were actually transferred to DCYF are things that we can essentially take over since they're our responsibility. So just trying to account for any of those instances if DHS continues to be named in legislation for things that we have taken on. And so that is Article 4, and I'm going to kick things over to my colleague, Shana Morris, to do Article 2.
And welcome to the committee, and if you can please state your name for the record and begin your testimony.
Shana Morris, a Legislative Director for Early Childhood at the Department of Children, Youth, and Families, and I'm going to cover Article 2, which has one section in it. That section specifically relates to supporting data transparency around the Great Start Compensation Support Payment Program. We found that the law was not as clear and explicit as it could be about how that data is classified, and so this is a proposal to make that absolutely clear. What it would say is that the provider that receives a payment and how much that payment is, the frequency of that payment is public, but it is not public information, anything related to their personnel costs or any information collected about the children and families that they serve. And that concludes Article 2, and I'll hand it over to my colleague Sarah Foreman to cover the rest.
Welcome to the committee, and please state your name for the record and begin your testimony.
Madam Chair. My name is Sarah Florman. I'm the Legislative Director for Child Safety and Permanency at the Department of Children, Youth, and Families. Article 3, which is child welfare, has three primary components. The first piece includes technical changes and housekeeping across chapters 260, 260C, and 260E to address technical and policy clarification needed across the child welfare system, including some clarifications to the MIFPA requirements, non-caregiver human trafficking assessments, and parental rights following the dissolution of an adoption. The second component allows for counties and tribes to provide a prevention response to educational neglect reports prior to a child protection response. The current statute requires a child protection response at 7 unexcused absences. In many instances, unexcused absences relate to poverty, which is often confused with neglect. This would allow counties and tribes to respond in a preventative, holistic response and provide resources and support without requiring a maltreatment response. Prevention will improve engagement and attendance while decreasing unnecessary entry into the child protection system and a decrease in disparities in the child protection system. The proposal still allows for that child protection response if the unexcused absences continue and the family is not engaged with prevention services. The third component has two parts, the first of which is related to the out-of-home placement plan. It aligns state statute with federal statute by requiring the out-of-home placement plan for children placed in foster care to be completed within 60 days, while maintaining the policy goals of the 2024 legislature by requiring the out-of-home placement plan summary within 30 days. This modification will decrease the burden on counties and local agencies, as children who are reunified within 60 days will not be required to have an out-of-home placement plan filed with the court. It will further support meaningful engagement with children, parents, and relatives and other caregivers to focus on a plan that addresses the child's well-being and supports reunification or another permanency option. The second part adds a court report and review 90 days before a foster youth's 18th birthday to inform the court about the youth's plan at this milestone. Youth who've aged out of foster care have told us that they need support to understand their options and plan for next steps as they age out of the system. Adding a court report and review before the foster youth's 18th birthday provides information to the court and other parties about the youth's plans and the agency's efforts to provide services and required documentation to support the youth's transition into adulthood. It also provides the opportunity for a youth or another party to request an in-person hearing if they have needs that have not yet been addressed. And that concludes Article 3.
Thank you, and I think that's all of the articles now that you've gone over. Okay. Members, do you have questions or comments about the bill? Senator Abler.
Thank you, Madam Chair, and maybe I'm reading this wrong, but on line 4316, talking about school attendance, this just came up in the Education and Policy Committee about changing the age of 12 to 14 with some large number of absences going to child protection. But I don't think this is ready for prime time. I was a strong supporter of the African American Family Preservation Act, if I got that name right. This is going to cause more unnecessary referrals. And so this says that a person has reason to believe that there's at least 7 excused absences. They have reason to believe there's at least 7, which is a low bar and reason to believe. And they're at risk of educational neglect or truancy. They're at risk of. And by the way, this person who has reason to believe doesn't even have to provide their name when they make a report. And then now you're going to get into child protection over that, which is flying exactly in the face of the African American Preservation Act, at least as an at-risk group, or tribes, or anybody who's just kind of busy. You got a single mom with 4 kids working 2 jobs. I just met one of those yesterday. They're trying to make it on $16 jobs, working hard. And then, because then it says on line 44.12, if the family is not engaged services, if the absences continue and the family is not engaged with services, then the local welfare agency can proceed with 260C, which is 141, which is a petition. What are you thinking? We can take it offline, but this is not the direction to go. It's not the direction to go. And we're short of time, but we don't want to send more people to petitions. We want to send more people into help. I've spent a lot of time on this over the years. I had a work group in 2017, and good people were shrieking at each other over how to best handle kids. These are like, you're a good person, you're a good person. Like the two of you are just shrieking at each other, not Senator Kupec, but over their beliefs about how to handle this. I'm just saying beware, and you can certainly comment, but Madam Chair, this is really problematic to me. It needs to be fleshed out as its own bill and have its own hearing and have 16 people come and talk about it, not stuck in a department bill and just brought forward with 5 minutes to talk about it. So I'm not trying to impugn the department, but please think it through, and I'm happy to get a comment. So, thank you.
Senator Abler, I just want to make sure that we have the department clarify that this language is what you're thinking. And because,
Yeah.
I mean, there are multiple bills, and we heard one in this committee, Senator Kunish that had to do with attendance and what happens with children with too many. Anyway, I want to make sure that the department can clarify that. Ms. Florman?
Thank you, Madam Chair. Yes, Senator, that's a great question. What this language actually does is correct something that is more punitive. Right now, there is a requirement for a child protection investigation with 7 or more unexcused absences. And what we're doing is switching this to a child welfare response. What we've heard from county workers is they want those toolbox resources to be able to provide those instead of moving directly to an investigation. So this is actually not creating more problems. It is ideally trying to keep people out of the child protection investigation.
Well, thank you, Madam Chair, and I appreciate
Senator
that.
Abler.
But the whole system is collapsing for kids going to school. I sat with a teacher from North Minneapolis, and like 70% of their kids go to school or something like that, and 30% just not going. So I think you need something even, thank you for trying to make it softer. But in the child protection world, there's not enough human beings that are experienced on the front lines of doing these intakes. And so 5 years ago, Ramsey County sat here and we'd like to have, the testimony was, I think 3 to 6 months before they make a decision. In 2 weeks, these new hires were putting people into the system because they're afraid to be in the paper. So thank you for the, so some person who's doing their best is going to wind up in this because someone's going to read even the better version of this. This needs to be totally redone. And maybe this is a step toward it, but come back with something better because it's not working. The kids aren't going to school and they just don't go because they don't feel like it. And the parents do their best. You got some incorrigible youth or you got some people who are not responsible parents. But anyway, so we don't want to create more opportunities for people to go into a petition because then you want to get permanency with 6 to 9 months. So like, oh my goodness, and maybe it's just a welfare thing. But then these poor parents who got the single mom job, they got to take off of work to go to sit there and talk to people, and now they're on a list, and it's, well, you know, you live in this world. I don't mean to get so carried away, but I guess I'm still upset about the first thing of the day. But can we talk about this some more? I mean, pass your bill, make it better, but in the grand scheme of things, this needs to be improved in a way that's actually going to get kids in school and help the moms and dads, particularly those who are at risk, which are falling through the cracks and are going to have just a really bad future. So anyway, sorry, I became Senator Mann there for a second.
Senator Abler.
Thank you.
We heard in our committee, it was a few weeks ago now, Senate File 942, and it's the same language as what's in this policy bill. And so, I mean, we had a discussion about this, so I think you, and if you could speak with the agency and just make sure that you are comfortable. I don't want to pass things that, are not agreeable, but,
Thanks.
but we did have
If it's
a
an
hearing on
improvement,
it.
good, but we need, in this committee, we need to, now that we have, especially with the department, with all this collage of stuff, maybe this department can come up with a better way than this even. But the idea about some person who's unidentified being able to push the start button on this whole thing, I think that's my objection in particular. At least they need to be identified to somebody. Otherwise, what's that term, swatting or whatever, where people just, you could make an anonymous report about me, and I don't have kids at home anymore, but it could be abused in this day and age. So I'll stop and I'll take it offline, and maybe it's fine for now, Madam Chair. So thank you.
Thank you, Senator Abler. I think if you continue to have a discussion, I appreciate it with the agency. And if there are things that need to be changed, we can do that. Members, Senator Liskey.
Thank you, Madam Chair. Madam Chair, I was reading through, and Senator Kupec, and I was reading through, and I got to page 9, lines .8, and so it's the paragraph about habitual truancy. We had talked about this, I think, in my office a few weeks ago, and I didn't really have any issues, but I actually got reached out to by a constituent yesterday, which is kind of strange timing, but I got an email from a parent. Her student has been reported as absent in her homeroom for the last 14 days, and it's getting reported, and now she's getting basically threatened like nothing can be done unless you bring a doctor's note, so on and so forth. And my concerns are that in this case, the student was actually going to school, was in the school building, was attending classes, didn't go to homeschool or homeroom because she was in other classes catching up or getting ahead in those classes. And so we have a teacher who, because the student doesn't come to the room, is reporting her absent. She's, petitioned that this is why she's not in the room, is because she's doing classwork elsewhere, still in the school building, still attending school. But now she's at risk of being truant. And I guess my concern around this language now after hearing this situation is, what are we going to do when a teacher decides to report you as absent even though you are in the building attending school and doing classwork? What kind of repercussions, what kind of out do we have in this situation for these types of situations? Because reading through this, it will directly go right into what Senator Abler was worried about. And so those two things combined could make for a pretty big problem.
Ms. Florman?
Yes, thank you. What I would say is that the change that we are trying to make should really assist in that situation. With the current statute, with that number of absences, a CHIPS petition would be on the table. So there would be an investigation, whereas now there is the ability for folks to do that child welfare response, to look into it and say, oh, this is an issue of the student not being in the room that it was expected, not an issue where the student's actually absent. So it allows for that kind of checking and double checking of the situation. And I do believe there's some conversations going on in education about what absences are, et cetera. So I think that's important.
Senator Liskey?
Thank you, Madam Chair. I appreciate that response. I guess the direction is the question, right? How do we handle, I don't like overbearing government in general, so having us as the state go and tell each of these individual schools, individual school districts, like, you have to do this or you have to do that, gets a little punitive. But at the same time, I also do worry that with the language here, that specific constituent, that student, now runs the risk of getting thrown into a system that they never should have been in the first place. And I guess I guess I'm going to take you at your word and hope that that's the right approach and that this is what it's going to solve the problem, not make it worse. But I do get concerned reading through that subdivision 19, going, okay, she's in rough shape. That student's going to be in rough shape, and I'm a little worried about it. So, just appreciate the dialogue. Thank you.
Any other member questions? Senator Abler.
Well, thanks, Madam Chair. Now I feel worse. And this is what I'm getting at. There aren't enough child protection workers to take care of people who really need child protection. And I'm concerned about the anonymous part now even more. And so you get an email from Big Boxer 49 that says, oh, I have reason to believe that this person has all these absences, and now you have to act on it. And so somebody should have to put their name somewhere with somebody confidential, if there's a reason to be confidential. But just the fact that they could just be anonymous because they feel like it, and now it has the same impact, is a problem. So maybe we can work on that part. You can tell me why offline. You can talk to me about anonymity is so important. And there's a time, in an abusive situation or something. But it shouldn't just be standard operating procedure, and then they act on it. When you said the CHIPS petition, it just my head lit up worrying about that. Because I know about the move to permanency, and now this poor person who's even wrong, now they have to go and defend why the report was incorrect. And then the staffer who has no time, and now the counties are losing money on all kinds of other things, and the governor's bill goes through, they're going to lose more staff. Then they're going to put their time into this thing, which is nothing. So we have to define some things as nothing. We did that before in some of the maltreatment stuff with nurses reporting and all that, and we have the authority to just define what de minimis is here. And this is a good vehicle for that, so maybe we can work on that along the way, and Ms. Sommerfeld and you all can come and tell me how we can make this work. Thank you. Madam Chair, I would like to at least have the opportunity to see if we can deal with that question of anonymity and then some of this threshold business to improve this bill. And so I'm fine to have it be there as a placeholder, and there's some ample time to work on it. So thank you.
Yeah, Senator Abler, the bill, because of some of the data sections, I believe it has to go to judiciary. So are you comfortable that you can work with the agency on that? Okay, thank you. Any other member questions or comments? I don't see any others. Any final comments, Senator Kupec? So the members, the motion would be that Senate File 2778 is recommended to pass and be referred to the Committee on Judiciary. Members, all those in favor, please signify by saying aye. Aye. Any opposed? The motion does prevail, and Senate File 2778 is passed and referred to the Committee on Judiciary. Thank you. Next, we will go to Senator Kupec, Senate File 2607. Senator Kupec.
Thank you, Madam Chair. This is the HCA policy, Healthcare Administration Policy Bill. This bill makes technical edits to new languages that were passed in 2024 session related to prior authorization. The modifications in this bill make conforming changes to statute to account for our public health care programs, medical assistance, and Minnesota Care. DHS has vetted these changes with the Minnesota Medical Association. Want me to read the two sections, or do you want to do it? Sure, I'll let my friends here do section 1 and 2.
Welcome. Welcome to the committee. Ms. Grom, please state your name for the record and begin.
Thank you, Madam Chair. My name is Christy Grom, and I'm with the Department of Human Services. Thank you to Senator Kupec for carrying another DHS policy bill, and thank you, Madam Chair, members, and especially staff for hearing these bills and making sure that they get a fair vetting before policy deadlines. So as Senator Kupec mentioned, this is our healthcare administration policy bill, and we have been working with partners over the interim on these changes. And on section 2, we'll talk a little bit about some ongoing work that we're having with partners. But in section 1, the underlying language being amended is in chapter 62M. And basically this language is outlining the requirements for prior authorization. So there was some prior authorization reforms that happened last session. And that language just needed a little tweak to apply to our public program. So instead of a plan year, we're noting that that's not really something that we use, a term that we use in our public program. So we're just changing that to a calendar year for our fee-for-service, Medicaid, and Minnesota Care programs. And then in section 2, we're removing a reference that is a list of statutes that was added last session that says that all of these statutes, although they're in a chapter that DHS isn't wholly subject to, would be subject to. And so these are all important reforms related to prior authorization. Most of these we are working on implementing. As you notice, the effective date is this upcoming January, so we're looking forward to getting those implemented. But there is one section, cross-reference 62M18, that doesn't apply to DHS, and so this is a requirement that would require DHS or require actually a health plan to post data about their commercial products on a website. But DHS doesn't meet the statutory definition of a health plan company, and obviously we don't have commercial products, so there's just a bit of a mismatch here that we think needs to get corrected. We actually think that there may have been an error in adding 62M18 last session because that statute was passed in 2020, whereas 62M.19 was actually the one that was passed in last session. So we think 62M.19 might be the right cross-reference to add there, and we're in discussion with our partners on that and with bill authors, both in this body and the other body. And with that, Madam Chair, I will stand for any questions.
Members, do you have questions about the bill? Senator Abler, you have an amendment, I believe.
An amendment. Actually, and so we're doing pretty well on time, so I'm not going to slow us down except talk about my amendments. I'd like to move to A1, please.
Senator Abler moves the A1 amendment.
And so the topic is prior authorization. This is a bill which you might be an author of, Madam Chair, and I've got a nice array of authors. Thanks to one of my own caucus members, I'm not getting a hearing in Commerce on it, but it's a problem. And so I don't intend to take it to a vote, but I do just want to have a brief conversation about it. This prior authorization business, in many cases, serves some good. Let's prior authorize a PET scan, a lumbar discectomy, which could, cost $30,000 to $100,000. But in many cases, at least at my end of the food chain, we're authorizing things that are de minimis. The most current case in point, a health plan, whose name I will not say because I'm not supposed to talk about what they pay us, pays me $22.38 for an office visit. And if you've listened to the hospitals and all the doctors, they can't live on Medicare fee schedules. This is a sub-Medicaid fee schedule that this particular plan has me on. And the people give me a $20 copay, and the remaining money is $2.38. And as my contract, I'm required to get my $2.38 or even keep the $20 to prior authorize this service. And this, to me, just seems to be one of the most foolish ideas I can imagine. For the one thing, $22.38 doesn't cover our cost. So I'm like doing this as a favor. This is a commercial product, Madam Chair, and to the body. This is not the Medicaid program. This is what we're so proud of, having people in the commercial market. And it is, we can discuss the reimbursement schedule in a different way, but to require the clinic to do this is just like foolish. If health costs matter, then the clinic at the end matters, but also the health plan decides that they're going to pay for this. And on a different time, I'll bring up a much broader topic about this, but lately, and so just see the industry practices on chiropractors and then expands it out. And so United Healthcare, which is not the provider in this case, is now doing pre-authorization of chiro, PT, and RT in the Medicare program, which in many cases are the lowest cost things to do. And so it just seems foolish. And so there should be some threshold at which it just does not make sense to pre-authorize. And so I picked $100, and I brought it forward to discuss, just to alert people to this. It's just pure foolishness in a world where hardware store owners are being charged a great deal of money to try to provide fully insured products for their people. We say we're after costs, we say we're after efficiencies, and then ironically, I'm almost done, Madam Chair. So why does not Alina use more chiropractic in their work? Do you know why? Because they can't make any money at it. We're paid so little that it's not cost effective for Alina to use chiropractors in their health system. And every study that's gone on has said if you see a chiropractor first for spinal conditions, there's way less scans, there's way less surgeries, and the outcomes are better. And I'm almost done, Madam Chair, but with Blue Cross, they come in. Lynn Nelson wants me to always mention them whenever I can, so hey, Lynn. So a person goes under Blue Cross coverage, spends $8,000 for their condition, gets a scan and some therapy and rehab and sees the orthopod, and then they come to see me and they're still not well. And then for $300, they're often like much better because we found the problem to fix. And so Blue Cross says, you want us to give you $300. That's the world we're in. And I keep thinking that at some point the lines are going to cross, that things have gotten so expensive, they're going to notice the most effective, inexpensive, quality care in the system. And no. First thing the governor did in his budget was get rid of chiropractic for people who are 21. Like, seriously. And save $7.8 million. Never mind, they didn't even cover what people might go anywhere else in that proposal. They didn't add back $1 for people to get counter care, and we're missing it. The future of healthcare is not in more medicine and more surgery. The future of healthcare is in what people pay cash for, alternative healthcare. There's herbs that do wonderful things. There's acupuncture, there's naturopaths, there's, and nothing wrong with the PTs and all the rest, but we're paying for the expensive stuff. When you go to a hospital, do you know what pre-authorizations are required? I've got a list. None. You can spend as much money as you want in a hospital with Blue Cross or United Healthcare or anything. They're going to have me pre-authorized $2.38. We've got it backwards. So with that, Madam Chair, I'm sorry I can't get a hearing in the committee it belongs in because the healthcare system has hypnotized certain people that there's nothing, the plans that hypnotize people like, oh, we've got to protect the plans at all costs, while they throw away money and charge hardware store owners more money and help them be unable to even pay their people better. So, Madam Chair, thank you for letting me talk. I don't even need a discussion, but I wanted to bring it forward. You're most kind. But if you want to solve healthcare costs, buy the cheap stuff. That actually works better. So with that, Madam Chair, I'll withdraw the A1. Thank you. Unless you wanted to talk about it.
Well, we're running out of time, and we have
Okay, thank you,
4
Madam
more
Chair.
bills to do, so
I appreciate it. Thank you, Senator Kupec, for the
appreciate
ride.
your bringing it forward. I see the point of I see the point of what you're trying to raise. Senator Utke, is that, okay.
Thank you, Madam Chair, and it's a question or maybe clarification for Ms. Grom, and it falls under the Section 2 because you did spend a little time talking on that. And I just, for clarification, it looks like, and I want to find out if it still reads this way, that the bill exempts DHS from public reporting of prior authorizations that still apply to the commercial market. Is that still in play? I know you were telling us about the one statute, whether it was right or wrong in here, but is DHS exempt, but we're requiring our private plans to publish this?
Before you speak, I just want to make sure that Senator Abler withdrew the A1 amendment. So, Ms. Grom.
Madam Chair, Senator Utke, this provision, so currently 62M18 would apply to the managed care organizations that DHS contracts with. So this requirement would continue to apply to commercial carriers and the managed care plans, but not fee for service, just because of the construction of it isn't wouldn't apply to DHS, but if there's a desire for the legislature for us to post, to do a report or something of that nature, we are more than happy to make sure that there's transparency in that. I would say there's other provisions in this section in subdivision 25C and 0625 that do require DHS to post on our website by January 26 how we operate our prior authorizations that are in place so that beneficiaries actually know how to navigate those and what they might expect when they're needing to get services or medications. So this is sort of an after-the-fact report. But yes, you are correct that this would, I mean, as it's written, it wouldn't apply. It doesn't really exempt DHS because it doesn't apply to us right now. So this is just a technical clarification.
Senator Utke?
Thank you, Madam Chair. And that's what I was after, is your fee-for-service isn't included at this point. So to be fair, at some point down the road, a fee-for-service should be added so everybody's treated the same. But thank you for the clarification.
Any other member? Senator Liskey.
Thank you, Madam Chair, and I'll make it as brief as possible. Of course, that never means anything in a committee. So with that being said, Senator Utke, I agree that the prior auth situation should be extended to all insurance agents or insurance providers. I think that the only reason it wasn't is because of the cost, the fiscal note that was included with the prior auth bill last year. So I appreciate that you're willing to talk about that as a broader spectrum because, as Senator Abler said, our providerships, especially in the natural health care world, I'm not in contract with that wonderful industry specific insurance provider because of the prior auth issue with that company. $2.38 for 14 pages of documentation for one patient, which then costs me time, it isn't worth $2.38. It costs me a lot of money to do that. And then the worst of it is, after filling out that prior auth form, we could get denied. And then now we've provided service for free. It just gets absolutely crazy. And so thank you, Senator Utke, for pointing out that everybody should be readdressing prior auth, not just the commercial plans. Thanks.
Thank you. Any other member comments? If not, we will lay Senate File 2607 over for possible inclusion. And next we'll move to Senator Mohamed's bills. So Senate File 2499. And members, if we can keep this very brief and get through these, we have two bills Senator Mohamed has and Senator Boldon has two bills. If we need more time to discuss, then we will have to return at 6 o'clock to finish the bills. Senator Mohamed.
Sorry, Madam Chair, I didn't hear. Which one are we doing first?
Senate File 2499.
Give me 1 second, Madam Chair. Sorry, I'm taking a while. Here we go. All right, sorry, I have a lot of bills this morning here. Thank you, Madam Chair, for hearing Senate File 2499. We're addressing a critical gap in how we respond to opioid overdoses. Right now, our data isn't fast enough to catch overdose spikes in real time. That delay means missed opportunities to save lives. Senate File 2499 helps solve this by allowing de-identified EMS data to be shared with the Overdose Detection Mapping Application Program. This tool is already used by nearly 300 Minnesota jurisdictions, but right now they have to enter the data manually, a time-consuming process that limits participation. By automating this data transfer, we improve speed and accuracy, helping first responders and public health officials act quickly when overdose trends emerge. Importantly, this bill does not mandate reporting and does not share personal information, only essential data like location and time and substance involved, whether naloxone was used. Access is strictly limited to authorized users and safeguards protect privacy. This is a common sense step to make overdose response more effective and reduce administrative burden, and ultimately save lives. And I appreciate you for your support.
Thank you. And Mr. Drucker, if you could please state your name for the record and begin your testimony.
Sure, thank you. My name is Jeremy Drucker. I'm the Director of the Office of Addiction and Recovery. Would like to start just by thanking Senator Mohamed for carrying this bill. Some of the background on this bill and the bill that will come after, it's really about getting better information so that we can respond more efficiently to the overdose crisis. If you look at sort of the history of the opioid epidemic and how we've been responding, we really started by just, as we saw fentanyl become the dominant drug in the market around 2019, we saw overdoses spike, and really the push became to just get naloxone out as quickly and as far and wide as we could. Now we're in a new phase where the drugs on the street are getting more dangerous. We are getting our arms around the overdose deaths, but we're really looking at how we can be more efficient and more strategic in our responses to make better use of our resources. I think some of the pullbacks that we've seen from the federal government are part of just kind of emphasize why it's more important that we get smarter about how we respond. And that starts with having good information. And so this bill will help us get better information to respond more quickly and more targeted. Thank you.
Thank you. Mr. Ferguson, did you wish to testify?
Dylan Ferguson, Director for the Office of EMS, only here largely if there were any technical questions, as it's our data that they'd be transferring, but we are supportive of the concept of this bill and it strongly encourage this common sense solution. Thank you, Madam Chair.
Members, do you have questions or comments about the bill? I see no questions or comments. Thank you, Senator Mohamed. And Senate File 2499. Oh, I'm being told that Senate File 2499 needs to be referred to the Judiciary Committee. And so Senator Mann's motion will be that Senate File 2499 is recommended to pass and be referred to the Committee on Judiciary. Members, all those in favor, please signify by saying aye. Aye. Any opposed? The motion does prevail, and Senate File 2499 is passed and referred to the Committee on Judiciary. Senator Mohamed, you have Senate File 2806.
I do. Thank you, Madam Chair. I'd like to start by offering the A1 amendment.
Senator Mann offers the A1 amendment. Members, this is an author's amendment. All those in favor, please signify by saying aye. Aye. Any opposed? The A1 amendment is adopted. Senator Mohamed.
Thank you, Madam Chair. Senate File 2806 ensures a more comprehensive understanding of naloxone distribution across Minnesota. It requires dispensers to report opioid overdose reversal agents to the prescription monitoring program, closing a critical data gaps without adding new infrastructure. The data will be used solely for internal analysis with strict privacy protections. Individual dispensation records will not appear on patient histories. Additionally, it allows for de-identified data retention to improve long-term trend analysis, aligning Minnesota with best practices in other states. This is a simple, common sense step to strengthen our response to the opioid crisis, like the other bill we did. Thank you.
Thank you, Senator Mohamed. Mr. Drucker, did you have testimony on this bill as well?
Thank you, Madam Chair. Committee members, I would just add to Senator Mohamed's testimony that this is part of our attempt to better understand just what the naloxone distribution landscape looks like here in Minnesota. So naloxone gets into the hands of our community members who are using it in multiple different ways. One of the ways that it gets into their hands is through pharmacies and through dispensing, and we currently don't have a window into what that looks like. And so as we try to get a better handle on what is the entire landscape of naloxone distribution here in the state, this bill is going to really help us achieve that. Thank you.
Thank you. And I also had Matt Flanders has signed up to testify. Welcome to the committee, Mr. Flanders, and please state your name for the record and begin.
Thank you, Madam Chair and members of the committee. My name is Matt Flanders, and I'm the Legislative and Policy Director at Citizens Council for Health Freedom, a national nonprofit health policy organization based here in St. Paul. For more than 15 years, our organization has opposed the ongoing expansion of the prescription monitoring program because it is a government-mandated surveillance program collecting private data on prescribers and patients without their consent. As such, we now oppose Senate File 2806, which aims to once again expand the PMP's data retention and use provision. It also changes the clearly defined term of controlled substances to the much more expansive term reportable substances. Under this broad term, the bill would expand data collection to opioid antagonists like Narcan or naloxone. In the future, what drug or substance not defined as controlled substance may be added to this reportable substance list. The Nebraska PMP collects data on every prescription, and the proposed change in this bill from controlled substance to reportable substance is a dangerous step in that direction. The PMP has a long history of mission creep. Over the years, it has gone from a voluntary tool to curb doctor shopping to a mandated reporting system, to now proposing to track not just the potentially misused controlled substances, but also the substances that remedy that misuse. By tracking opioid antagonists, will people be less likely to buy these life-saving medications? And will they fear being identified as drug users? We find no comfort in lines 10.20 to 10.21, which would at least initially restrict access to this data. We are concerned that with the clear history of mission creep within the PMP, this data could be shared with prescribers or dispensers in the future. Imagine the unintended consequences of a doctor being hesitant to prescribe a pain medication to a patient because they have an opioid antagonist on their record. Ultimately, will people be less likely to obtain these potentially life-saving medications because the state decides to track them? Finally, we strongly oppose the change to PMP data retention on lines 5.3 to 5.7. In the past, a one-time expansion of data retention was granted to the board. This went away in 2020, although there were multiple attempts to extend or make it permanent. Now this bill aims to create a permanent government database of prescription data reported and stored without patient consent. For these reasons, we urge the committee to oppose Senate File 2806, which perpetuates this unconstitutional infringement of privacy rights, advances PMP mission creep, and may increase opioid deaths if individuals stop purchasing products like Narcan for fear of being tracked. Thank you.
Thank you. Members, do you have questions or comments about the bill? Senator Ehler.
I guess it's just the day. Thank you for coming. Just sit down a second there, if you don't mind. I was just actually reading the bill. Nobody lobbied me on this. And so I don't know why we do want to report Narcan and put that in someone's file. And it's if you look at the protections, the bill on line 1020, it limits access to people on lines 619 to 622. Which is personnel of the board. Of course, they're trustworthy, I suppose. Authorized personnel under contract with the board or under contract with the state of Minnesota and approved by the board to engage in the design, evaluation, implementation, operation, or maintenance of the program. And it's minimized. That's a lot of people. And a person in the maintenance would be software people going to a company offline. And so it's the way that people are getting hacked and everything these days. I think this needs to be thought through, Mr. Drucker. I don't think this bill is ready. And I think if you're going to limit, I think you want to decide why you want to report Narcan in the first place, and what that could do for somebody in their future, the way everything is being shopped around. And, I've admitted my problem in college with my use, but some people don't want to. I just said that for purposes of people that they won't feel alone, and that we should talk about this more. But I just caution us. And I think, Madam Chair, you can do what you want with this bill, but I don't think it's ready to go. And I'm willing to work with Mr. Drucker and others to make sure that harm doesn't happen. I was the author of the PMP in the beginning, and again in that meeting, Madam Chair, there were doctors and members of the board just like sideways. I wish I could have, it was like one of the most dramatic meetings about it, and it's come a long ways to be accepted and usable, and I think it's got benefits. So is this moving, or what's happening to this, Madam Chair?
Senator Abler, we're going to lay the bill over.
Yeah. So I would just encourage us not to put it into your delete all just yet. So, and I'll work with Mr. Drucker. Thank you.
Do you have a brief comment, Mr. Drucker, about a response?
Yeah, thank you, Madam Chair, committee members. Senator Abler, certainly we recognize that there are a lot of tentacles that come to some of these data bills. And so, we do think that as we look at overdose response in terms of understanding where naloxone is in the community and making sure that communities have naloxone in the quantity and format that they need in order to save lives, getting as close of a picture to that as possible so we know where to move resources in conjunction with the OD MAP bill is really critical, especially as resources are becoming more limited. But we certainly recognize and we don't want to do anything that would undermine individual freedom, liberty, anything like that. And so we're delighted to work with Senator Abler to make sure that any concerns are addressed and we're really achieving the goal of this bill, which is to prevent overdose deaths and not perpetuate anything that may be negative.
Madam Chair.
Thank you. Senator Abler?
No, it's a high-minded purpose, and I totally agree. But actually, we are changing what's collected and, how it can be used. And at some point, this should go to judiciary for a data review, I think. And so I'll work with Mr. Drucker. And this is maybe a project for the interim where you can actually get it cleaned up and take it forward next year. But just the fact that we need to protect people from opioid uses is not a good enough reason to take people's privacy and possibly harm them in the future. Thank you.
Thank you, Senator Abler. Are there any other comments or questions about this bill? I think it does warrant more discussion. We will lay the bill over, and then if more work is done, if there's more modifications, we can talk about those. So you can keep me posted, Senator Mohamed. So Senate File 2806 is laid over for possible inclusion. And we have two more bills. Is it possible for us to continue and get these done, and then we don't need to come back this evening? Okay. All right. Senator Boldon, are you able to present them? Okay. And so Senator Boldon has Senate File 2507, and I show Ari Didion as your testifier. Senator Boldon.
Thank you, Madam Chair. This is the Office of Inspector General Children's Policy Bill. And just very briefly, I'll mention a few things that it does. It has a family and child care licensing technical correction. It addresses certified child care centers, some policy modifications. It addresses child passenger restraint systems training. It addresses some licensed child care centers, just a technical change, and addresses CCDF federal compliance. And with that, I will hand it over to our testifier.
Thank you. And we do have, there's an A1 amendment. Ms. Didion, is this do we need to pass this to get the bill in the shape that you are ready to discuss? Okay, members, Senator Boldon moves the A1 amendment. All those in favor, please signify by saying aye.
Aye.
Any opposed? The A1 amendment is adopted. Ms. Didion.
Thank you, Madam Chair. Ari Didion, Legislative Director for the DHS Office of Inspector General. As Senator Boldon said, this is our children's policy bill. So this primarily relates to the licensure that's going to be moving to the Department of Children, Youth, and Families in June. And in the interest of time, I will stand for any questions.
Members, do you have questions? Senator Liskey?
Thank you, Madam Chair. I guess just one very brief question. What made the change from 8 years of age to 9 years of age?
Ms. Didion.
Madam Chair, that was a change that the Department of Public Safety oversees the child passenger restraint training. And so that was a change that they made to the training last year. And so this is just updating licensing statute to reflect those changes.
Senator Liskey.
Thank you, Madam Chair. That answers all I need. Thanks.
Okay. Any other? Senator Abler.
Thanks. There's some language stricken on 621 and following. Does that take anything away from flexibility, or just, I'm trying to figure out what that even says, so. It's a deletion, it's 621 to 633. It offers emergency flexibility that we don't need, or you don't want anymore, or what?
Madam Chair, Senator.
Ms. Didion?
Madam Chair, Senator Abler, I believe that is also part of the child passenger restraint training, and so this is just updating or aligning our statute with their statute.
Senator Abler, and I guess that's what's on this chart under section 3. It says removes the emergency relative variance due to changes in the DPS training delivery model. Senator Abler?
Fine.
Okay.
Thank you.
Any other questions? Okay, I don't see any other questions. Senator Boldon or Ms. Didion? No? All right, we will be laying Senate File 2507 as amended is laid over for possible inclusion in an omnibus bill. Senator Boldon, and you have Senate File 2506.
Thank you, Madam Chair. Senate File 2506 is a DHS behavioral health policy bill that modifies mental health programs. DHS engaged with behavioral health providers and advocates to ensure that they did not have concerns and to solicit ideas to improve the proposals. The first part of the bill clarifies standards for children's mental health targeted case management, and the second part codifies school-linked behavioral health grants for intermediate schools. The bill does not have a fiscal impact, and Christy Grum from DHS is here to provide a very brief overview of the specific modifications and why they are needed.
Welcome back to the table, Ms. Graham. Please state your name and begin your testimony.
Thank you, Madam Chair and Senator Boldon, for hearing this bill and for authoring it. Just to do a quick overview, sections 1, 2, and 3 of the bill do relate to clarifications that we're making for children's targeted case management, mental health targeted case management. So there are requirements in various spots across law for targeted mental health case management. And so there's requirements in the Children's Mental Health Act, the Adult Mental Health Act, and then Medicaid statutes. And then, of course, we also have our state plan amendment with the Centers for Medicare and Medicaid Services. And so the changes here are really just aligning all of the requirements to make sure that where we have providers who are oftentimes serving both children and adults, that the qualifications and requirements are the same, and that we're aligned with the requirements in our state plan amendment in statute. And then the final section, I believe, of the bill, section 4, as Senator Boldon stated, it's really just codifying an existing grant program, which is for our, I believe, 4 intermediate school districts to provide services that are mental health and substance use disorder services co-located in those schools to support our children, youth, and families. In a, the least restrictive setting, and to make sure that they've got the supports they need to do well. So this isn't adding any kind of new grants, it's really just codifying it in statute because it lives in session law right now. And people would have to rifle through old session laws from, I think, 2007 or sometime 2017, a long time ago, to be able to find what the requirements are. So this just helps, I think, our grantees to be able to understand clearly what the requirements are, and also holds the department accountable that these are the standards that that we're administering these grants by. I'll stand for any questions, Madam Chair.
Great. Members, do you have any questions? Senator Udke.
Thank you, Madam Chair. And you're talking about the grant funding and such, and this is just a policy bill at this point, correct?
Ms. Graham.
Madam Chair, Senator Udke, yes, this is a policy bill. The grant this doesn't have a fiscal impact. There's current grant funding. This is just putting what already exists in session law, which has the full force of law, into statute.
Senator Udke.
Thank you, Madam Chair. My follow-up to that would be then, where does this money come from or originate from that you're able to do these grants under this under the statute or under this bill that we're talking about?
Ms. Graham.
Madam Chair, Senator Udke, typically most of this funding is appropriated by the legislature, yourselves. There is some funding that we get, I believe, through federal SAMHSA dollars to pay for schooling behavioral health as well. That's a little bit different. That most of the funding, I believe, is state appropriated, though.
Senator Udke.
Thank you, Madam Chair. And just a quick follow-up to that. If you could check into that and actually follow up with me, I'd appreciate it, because at this point it appears that we can't track it, and we'd be interested in knowing where it's coming from, but we can do that offline, so thank you.
Thank you. Any other questions? I don't see any other questions. Thank you for bringing this forward, Senator Boldon. And Senate File 2506 is laid over for possible inclusion in an omnibus bill. And we have reached the end of our agenda, and we are adjourned.